Before using the Humira pen Crohn-Uc-Hs starter injector kit, make sure to read the medication guide and instructions for use provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. If you are using this medication at home, learn all preparation and usage instructions from your healthcare professional and the product package. Before using the medication, visually check for any particles or discoloration in the liquid. If present, do not use it. If you are removing the medication from the refrigerator, leave it at room temperature for 15 to 30 minutes before injecting. Do not warm up the medication in any other way, such as by heating in the microwave or placing in hot water. Before injecting each dose, clean the injection site with rubbing alcohol. Change the injection site each time to lessen injury under the skin. New injections should be given at least 1 inch, 2.5 cm, from an old site. Do not inject into any areas of the skin that are sore, bruised, red, or hard. Use this medication exactly as prescribed by your doctor. Inject this medication under the skin on the thigh or abdomen as directed, usually every other week or once a week in some cases. The dosage is based on your medical condition and response to treatment. In children, the dosage is also based on weight. If you are using this medication to treat psoriasis, hidradenitis suppurativa, Crohn's disease, ulcerative colitis, or uveitis, your doctor may prescribe a different schedule or higher dose at the start of your treatment. Carefully follow your doctor's directions for using this medication. Be sure to learn how to store and discard medical supplies safely. Use this medication regularly to get the most benefit from it, and mark the day on the calendar when you need to receive this medication to help you remember. Do not increase your dose or use this drug more often or for longer than prescribed. If your condition lasts or gets worse, be sure to tell your doctor. If you experience redness, itching, pain, or swelling at the injection site, let your doctor know. This medication has been prescribed because the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Contact your doctor right away if you develop signs of infection, such as a sore throat, cough, fever, chills, night sweats, trouble breathing, painful or frequent urination, unusual vaginal discharge, or white patches in the mouth. Also, tell your doctor right away if you experienced serious side effects such as fast or irregular heartbeat, new or worsening symptoms of heart failure, blood in the stools, mental/mood changes, severe headache, easy bruising or bleeding, leg pain or swelling, numbness or tingling of the arms/hands/legs/feet, unsteadiness, unexplained muscle weakness, difficulty with speaking or facial movements, vision changes, joint pain, or a butterfly-shaped rash on the nose and cheeks. Additionally, adalimumab may rarely cause serious liver disease in people exposed to hepatitis B virus, so contact your doctor if you experience symptoms such as nausea, vomiting, loss of appetite, stomach/abdominal pain, yellowing eyes/skin, or dark urine. Seek medical help right away if you experience seizures or chest pain, and get immediate medical help if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed, contact your doctor. Before using the Humira pen Crohn-Uc-Hs starter injector kit, it's important to inform your doctor or pharmacist about any allergies you may have, especially to adalimumab or any of its products. This medication may also contain inactive ingredients that could cause allergic reactions, so it's important to discuss this with your pharmacist. Before starting this medication, it's crucial to inform your doctor or pharmacist about your medical history, particularly if you have had recent or repeated infections, blood or bone marrow problems, seizures, certain brain or nerve disorders, cancer, heart disease, or lupus. It's important to note that adalimumab can increase your risk of infections or worsen current infections. It's best to avoid contact with anyone who has a contagious infection, and to consult your doctor if you have been exposed to an infection. Before getting any immunizations or vaccinations, it's important to inform your healthcare professional that you are using adalimumab. It's also recommended to avoid contact with people who have recently received live vaccines. To minimize the risk of injury, it's important to be cautious with sharp objects and to avoid activities that may result in injury, such as contact sports. Before undergoing any surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's important to note that older adults may have a higher risk of infections and cancer while using this medication. If you are pregnant, it's important to discuss the risks and benefits of using this medication with your doctor. It's also important to consult your doctor before breastfeeding while using this medication. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include other TNF blockers, such as etanercept and infliximab, as well as other drugs that weaken the immune system, such as abatacept and anakinra. Always consult with your healthcare provider before taking any new medications while using Humira Pen Crohn-Uc-Hs Starter Injector Kit. If someone has taken too much Humira Pen Crohn-Uc-Hs Starter Injector Kit and is experiencing severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical attention. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's crucial to act quickly in these situations to ensure the individual receives the necessary medical care. It's important not to share this medication with others. While using this medication, it's crucial to undergo lab and/or medical tests such as complete blood count and liver function. It's important to keep all medical and lab appointments. Make sure to consult your doctor for more details. If you forget to take a dose, it's important to speak with your doctor or pharmacist to figure out the best time to take your next dose. Never take a double dose to make up for a missed one. When using the Humira Pen Crohn-Uc-Hs Starter Injector Kit, it's important to store it in the refrigerator, but do not freeze it. Some brands of this medication may also be stored at room temperature, so be sure to ask your pharmacist or read the product package to see if your medication can be stored at room temperature and for how long. Once the medication has been stored at room temperature, it should not be put back in the refrigerator. Keep the medication in the original container to protect it from light. Remember to discard any unused portion of the medication and keep all medications away from children and pets. It's also important not to flush medications down the toilet or pour them into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.